Hello and welcome to week 6 of PA114. This week we are in chapter 19. We are talking about ear, nose, and throat drugs. So remember that your assignment is due on Sunday, and it will be the chapter review at the end of the chapter. And then also we are talking about comparing and contrasting the therapeutic effects of antihistamine drugs and mast cell stabilizer drugs. So that's mostly what this lecture will be about today. So starting on chapter 19, page 331, we're talking about ear, nose, and throat, or most commonly known as ENT drugs. They treat diseases of the ears, nose, and throat, such as swimmer's ear, otitis media, allergic rhinitis, sinus congestion, colds, inflammation, yeast infections in the mouth, and coughing. ENT drugs include decongestant drugs, antihistamine drugs, and then mast cell drugs, corticosteroid drugs, antibiotics, anti-yeast, and antitussive. And so we'll talk a little bit about each of those as we're going through this. So the decongestants is how they start this chapter. It helps to reduce flow to the mucous membranes in the nose, sinus, and pharynx. So really just reducing those inflammation so that you're able to breathe. This also has to do with a naso spray like Afrin, 12 hours. And then going into the antihistamine drugs, these exert their therapeutic effect by blocking histamine or H1 receptors in the nose and the throat. Histamine is released from mast cells in the tissue, and an antibody-antigen complex is created during an allergic reaction. So a lot of us in this springtime are having that. These examples are like Zyrtex, Clarinex, Allegra, Claritin, and some of these are over the counter. It goes more in depth. Like the first generation antihistamine drugs are like Benadryl, whereas your second antihistamine drugs or second generation antihistamine drugs are Zyrtec and Claritin. Most of these used to be prescription form. Now they are also over the counter, so you can get them. Now none of them are good at treating bacterial infection, so we'll get into that of why you would want an antihistamine for that. Here's a mast cell stabilizer drugs. They're 335, and they help the cell membranes of mast cells in the tissues of the nose and prevent them from releasing histamine during the immune system's response to an antigen. This prevents edema of the nasal mucous membranes and sneezing in patients with allergic rhinitis. So you can tell they're a lot very similar. Like in your discussion questions, you're talking about the therapeutic effects, comparing and contrasting. They both have to do with the mast cells. And the example that they give you is nasal crom, and this is a nasal spray that is in prescription form. It goes on to talk about corticosteroids. This decreases inflammation and edema in the mucous membranes, and these are like Nasocort, Rhinocort, Flonase, again, nasal sprays, Nasonex, and then they have also the drug labels that you can look at. Going into antibiotic drugs, I mentioned these before. These are for bacterial infections, and if it's gone past that, sometimes if you have maybe a cold or something that you haven't taken care of, then it goes into a bacterial infection, and this is when you would have an antibiotic. Can be colds, sore throats, those kind of things, given orally. One that they've talked about here is Foxic Odic is the eye drop or Odic is the pertaining to the ear, so an ear drop. Also goes into anti-yeast drugs, antitussive drugs, expectorants. One of the expectorants that you should know over the counter is Mucinex. And then they have the combination ENT drugs, and a lot of them are what you will find over the counter and what most people are looking for during this cold and flu and spring season. So Allegra D, Clarinex D, Zyrtex D also include that pseudoephedrine within them. So all these drugs that include that pseudoephedrine will also need to be signed for in the pharmacy. Remember that most states have that law now that you can only buy a certain amount of pseudoephedrine within a day period. And so as you go into although they are not prescription form, they don't need a prescription form, they have to sign for them with their driver's license. So it tells us how many times they've bought pseudoephedrine drugs. All right. And then going into the last page, the combination ENT drugs ends with some odic and drops that you can put in your ear for ear infections and things like that. So you might read a little bit about that. And then your chapter review. Hopefully that will help you answer your discussion questions and then also your assignment. Have a great week, and if you have any questions, let me know and email me. Have a great week. Bye-bye.